Hi, I'm Dr. Jay Hall. This video focuses on the application of tympanometry in hearing screening of preschool and school-age children. I'll talk specifically about performing tympanometry with the GSI Allegro device. Tympanometry is a quick and sensitive measure of middle ear function. Although tympanometry is not a test of hearing, recent research confirms that combining tympanometry with DPOAE or pure tone hearing screening substantially increases the likelihood of detecting hearing loss in young children. Tympanometry contributes in different ways to a successful hearing screening program, especially with preschool and young school-age children. Tympanometry is a direct measure of middle ear function. Middle ear problems are the most common explanation for refer outcomes in the hearing screening of young children. Tympanometry can be recorded from almost every child, including very young or immature children who cannot be tested with the pure tone technique. And tympanometry is very quick, requiring only a few seconds of test time. Like DPOAE screening, tympanometry is entirely objective. The child doesn't need to listen to or pay attention to sounds during tympanometry. The results of tympanometry can be analyzed and then printed or stored to document middle ear status at the time of hearing screening. Recent research has confirmed that a hearing screening program that uses a combination of tympanometry and DPOAEs will identify kids who need further testing at the same rate as pure tone hearing screening. In addition, the combined DPOAE plus tympanometry screening method will identify some children who would have been missed with the pure tone hearing screening technique. It's also important to note that tympanometry screening can be performed on children who cannot be tested with the pure tone technique. When you first arrive at the screening venue, put the GSI Allegro device into the charging cradle and be sure there's adequate battery power. Also, take a few minutes to perform a calibration check of the Allegro with each of the 4 test cavity sizes. Take a close look at the end of the probe and make sure that the tiny tubes or ports are all clear. Also, be sure that you have a good supply of different sizes and colors of clean silicone ear tips. Here are a few steps that you should take before performing tympanometry with each child. Take a moment to inspect the child's outer ear and ear canal. With a smile on your face, mention to the child that you need to take a quick look at each of their ears. Make note of anything unusual or unexpected, such as growths, evidence of injury, atypical shape or position of the outer ear, small pits in the skin, or skin tags in front of the ear. Also, before inserting the tympanometry probe into the child's external ear canal, it's important for you to inspect it for any evidence of debris, earwax, or foreign objects. If you've already conducted DPOAE hearing screening with a child, you can use the same silicone ear tip for tympanometry. If you are performing tympanometry first, then make note of the size of the ear canal opening during the ear inspection and think about the color of the silicone ear tip you want to use on the probe of the Allegro device. Slide the appropriately sized silicone ear tip as far as possible on the Allegro probe. For tympanometry, you do need to obtain an airtight seal between the probe tip and the ear canal walls. Instructing a child about tympanometry is simple. Pleasantly inform the child that you'll be checking out how their ears are working. You'll be lightly touching their ears. The child may hear a buzzing sound, but the child doesn't need to listen to the sound or to tell you if they hear it. They just need to sit quietly for a short time. We'll now review the middle ear screening steps with the Allegro device. This screening test will automatically perform a tympanogram and a reflex screen at 1000 Hz. Turn on the device and select New Test. Then you'll be prompted to select the test ear. For this protocol, you will select one ear at a time. You will screen the right ear first, and then you'll repeat the process for the left ear. When you select a new test in the test ear, right or left, The device provides visual prompts at each step in the test process. The first message is Insert Probe. At that time, you will insert the probe against the opening of the ear canal to obtain an airtight seal. Keep the Allegro device at that position for the entire test. Additional messages will inform you of the status of the screening test. These include equalizing pressure, pressure settling, seal obtained, taking tympanogram, and seeking IPSI reflex. When the test is complete, tympanometry results automatically appear on the display screen. There is a box on the display screen that indicates the normal range. Most children will have normal tympanometry findings and the presence of an acoustic reflex. According to the recommended protocol, criteria for a refer outcome on tympanometry are a flat type B tympanogram or a tympanogram with a peak that is at a pressure value of less than minus 250 decapascals. The recommended hearing screening protocol for children under the age of 7 years includes tympanometry plus DPOAE screening. Recent research clearly confirmed that adding tympanometry to DPOAE screening increases the sensitivity to hearing loss by about 20%. Combining tympanometry with DPOAE measurement results in detection of hearing problems associated with middle ear disorders as well as permanent sensory hearing loss. Tympanometry should not be recorded in some children, including any child with drainage of fluid from the ear, a report of recent ear surgery, blockage of the external ear canal, or a child complaining of ear pain. We just discussed how to perform successful middle ear testing for your screening program. There are a number of additional resources available to you to learn more about tympanometry and how to use and interpret tympanometry results. I would encourage you to take a deeper dive by reviewing the equipment tutorial videos available with this video.